along with Brittany and Brenda. We'll go ahead and get started. We have an action-packed lunch hour for you, where we're going to talk about building community in your classes. You guys, many of you attended our session in February with Dr. Patricia Sexton, where we talked about cultures, not just about skin color. This is a continuation of that same theme, where we're going to talk about difference, disability, and access within the ATSU learning communities. And then we have another presentation next month where we're going to talk about inclusive teaching, some awesome practical strategies for facilitating diverse perspectives in the classroom. So we hope that you join us again in April. But for those of you here today, here we go. I'm very pleased to introduce to you our guest speakers for today, Jennifer and Marty. Many of you already know them. Jennifer McNeely is the current director of the Learning and Disability Resource Center, all the way back from July of 2016. And of course, we have Marty Allison, who is an advisor in the same department, the Learning and Disability Resource Department. Both Jennifer and Marty are members of the Association on Higher Education and Disability, and they also are members of the Coalition for Disability Access in Higher and Health Science Education. They both are very active in keeping up with disability law, as well as best practices in the field of disability services. They participate in many several training webinars each year as well, and also are active participants on the disability services listservs around the country. Without further ado, please welcome Jennifer and Marty to talk about difference, disability, and access within ATSU learning communities.
Thank you, Quincy, Brittany, and Brenda, and to all of you Zooming in today. So Marty and I are here today to share a little bit of information and hopefully get you thinking about student differences, disabilities, and access to learning at ATSU. So through our sharing and our discussing, we hope that you come away with an openness to student differences within your learning communities. I'll start with a little bit about our roles in disability resources. ATSU students with disabilities who are requesting accommodations must contact us to begin that process. We do not assess students for disability, but we are responsible for determining a student's eligibility for disability-related services and whether reasonable accommodations can be provided. We use information from the student, documentation from the student's healthcare provider, and sometimes the accessibility liaison from that student's program to inform our determination. So the accessibility liaison is typically an administrator or a faculty member within each program who has intimate knowledge with the program requirements so that we can determine whether an accommodation would be reasonable for that particular student. Okay, so that's why we're here. And what are we going to cover today? Well, we are going to talk about difference, disability, and access. That's part of our title, so hopefully we will cover those. We're also going to talk about the services that Learning and Disability Resources provides and a bit of our processes for providing those services. We're going to talk about how you as faculty can help in that with students and within those processes. And we're also going to go through some sample student scenarios, and these are going to be just hypothetical students with disabilities, and we're going to kind of talk through our process, and also we're going to hopefully elicit some ideas from you all as to what adjustments might be helpful for these students in your learning communities. So we're going to be asking for your participation as we go, so please don't be shy. If you have questions or you're going to participate, feel free to type those into the chat, or be brave and come off mute. But we are ready for you to participate. Okay, so I'm going to hand it off to Marty, and he is going to get us rolling.
Thank you so much, Jennifer. So yeah, we'll start off with a little bit of participation on this one as well. I'm citing things from ATSU's Office of Diversity and Inclusion. This fell under a heading of diversity is more than hue. So here it's going to say ATSU believes diversity is an authentic understanding and appreciation of differences and at its core is based upon the value each human being brings to our society and each person's access to opportunities to contribute to our university's cultural proficiency. So using either the chat or if you wanted to unmute, what are some ways that ATSU students are diverse? What ways do they differ from one another?
Any ideas? This is the audience participation. Socioeconomically, previous educational experiences, program. They're all here to learn. Okay, that's how they're similar. How are they different? Cultural, religion, ethnicity.
Yeah.
Okay, those are some great examples.
Yeah, and these are all great, and we've got a very diverse community, and I would say that disabilities, whether seen or unseen, contribute to this diverse environment. So Jen, I wonder, could you further address some of the disability and learning?
Yeah, diversity and learning. So one of the, I'm not sure if anybody threw this in the chat already, but obviously students come to ATSU with different learning methods. So pretend you are a student and you have a quiz tomorrow and you need to learn these words. You are going to be tasked with reproducing these 12 random words from memory, but not in any particular order. So how would you go about learning these words for a quiz tomorrow? Any ideas?
Alphabetically, mnemonics, chunk them, make up a song.
Oh, I like that one.
Construct sentences, flashcards, a story, use them in sentences, repeat writing.
Yeah. Oh yeah, memory palace, that's a good one. Okay, so these are great ideas. And really the point of this exercise is to recognize that there really is no one size fits all when it comes to learning. You came up with varying methods just as our students do. So keep that in mind when students come to you for assistance. And, obviously this task was a very simple one compared to what students at ATSU are required to learn and assimilate. So you know how you would go about learning the material that you are teaching, but is that the only way? So just be open to differing methods of learning. And keep in mind that besides providing disability services to students with disabilities, our department also provides learning support to all ATSU students. Our team includes learning advisors who meet with students one-on-one for learning advisement. We talk about learning preferences, we maximize strengths, we bolster weaknesses. We also coordinate the PAL mentoring and tutoring program. So having a disability is just another difference that a student might bring with them to ATSU. And students with disabilities, especially visible ones, visible disabilities, inform all of us about the abilities of individuals with disabilities. They demonstrate that disability does not mean inability. So they add diversity and contribute to ATSU's cultural proficiency. The Centers for Disease Control estimates that 26% of Americans report having a disability. The Americans with Disabilities Act and Section 504, those are the two federal regulations that institutions of higher education and other entities adhere to prevent discrimination on the basis of disability. They define disability a little bit differently. They define it as a legal term, not a medical term. And that definition is a physical or mental impairment that substantially limits one or more major life activities. And so substantially limiting, that is kind of a vague term, and there is no clear-cut guidance on that. But the way it is determined is by assessment of the current impact of the impairment as compared to most people in the general population. So that's on a case-by-case basis that assessment is made. So ATSU is committed to providing needed accommodations for students with disabilities. However, ATSU program standards must also be upheld. So having a medical condition or a diagnosis does not necessarily mean that accommodations are required. The impairment must be substantially limiting and create a barrier to access. Marty is going to talk now about disability language.
Thank you. So with disability language, there's really two primary models regarding the language used to identify members of the disability community. I'll go over each of those. The first is person-first language, and the second will be identity-first language. So with person-first language, an example of that verbiage would be, I'm a student with a disability. So in that language, it's something where this individual is separating themselves from the disability. And a lot of that, it's based on the stereotypes. Oftentimes there are negative stereotypes. So they want to be separated from that disability and the negative connotations that may be associated with that. Again, it's, I am a student with a disability. The person-first language will state person with disability. In contrast, we would have identity-first language. An example of how that would sound, I am a disabled student, would be how that would come across. In this, it's something where the individual is claiming their disability, but they're recognizing the environment around them. So they're directly claiming things, but the language recognizes that a matter of inaccessibility may actually be part of that environment. So it's an oppressive system or a structure, something within the environment. As an example for this, I would think, let's say you had an issue where your legs were not functioning well and you had an issue with mobility, and you want to wash your hands in a public place. Well, the task of washing your hands, will those crutches or wheelchair interfere with that task? It's not something that's directly related to that, but in the right environment, there may be no issue with the fact that your legs are not working properly in order to accomplish this task. So the identity first is going to look at the overall environment and say that that's what's causing the disability. So would disability in itself be considered inappropriate or incorrect? Is it a dirty word? When you compare the person first or the identity first language, what's the right one to use? And it's something where really the guideline with this may be, what is the individual that's in that disability community using to identify themselves, and just mirroring that same similar type of language. As mentioned before, Jennifer and I are members with the Association for Higher Education and Disability. This year, they recently issued something stating their stance on it, that they weren't dictating this is what you should do as far as one or the other, because there are instances where either one would be appropriate. But their stance was that they were leaning towards the identity first, just because they were more of a social justice and trying to incorporate the equality in that. As far as things with our students, no matter what type of language the student is going to use, there may be reasons that they may not want to disclose. Is that something, would anybody think of reasons that a student may have concerns? And feel free to add this in the chat, but any reasons that a student would be concerned about disclosing a disability to their university?
Judgment, stigma. They don't want to stand out, viewed as different, less able, faculty bias. Yeah.
These are all great examples. Yeah, they're kind of regardless of the language, there still can be a stigma around having a disability and declaring yourself as that. Our students are very competitive, they're very successful, and they may not want to be seen as different. And really, it's difficult to ask for help. And any type of request for help is really a request for equal access. So what does access mean? If we were to go with the dictionary definition, it's the ability, right, or permission to approach, enter, speak with, or use. So, that's the overall definition, but in the context of access to education, what would be your goal related to access when you're serving a diverse population? I don't know if there's any goals coming into the chat. I would say one thing, our role is not necessarily to ensure success, but it's access or equity. So in this slide, we've got having the access, having the goal of equity, comparing equality to equity. What I would think of with this visual, think of the home run that's about to happen as somebody understanding your subject matter. So you want everybody to be able to have access to that. I might even imagine each of those crates as some kind of unit of time. Maybe it's something spent with a tutor, with an instructor one-on-one, reading a subject matter, independent research. If each unit of time, if everybody is getting an equal amount or spending an equal amount, do they all have access to see that home run? They have different needs. So equity would mean there's going to be more devoted to those that would better benefit from that, so that everybody can enjoy that same equity. From here, we'll transition over to some technical standards that we would have as well.
Great, thanks, Marty. Okay, so technical standards. So some of you may not be aware of these. Probably a lot of you are. Each ATSU college and or program has a set of technical standards. And what are they? Well, they are the non-academic admission criteria, physical and other requirements that have been deemed essential to participate in a particular program of study. And how are they used? Well, qualified candidates must be able to meet the technical standards of their program, either with or without accommodation. So when a student is accepting a seat into an ATSU program, they attest that they can meet the technical standards of their program, either with or without accommodation. So if it's a student with a disability who is requesting accommodation, they would contact us and we would begin a process to determine their eligibility and then whether reasonable accommodation could be made. If a reasonable accommodation couldn't be made for a particular technical standard, then that student with a disability would be deemed not otherwise qualified to participate and could be denied admission to or graduation from a program. So those technical standards can be a kind of a guideline for accommodation. They're basically the minimum qualifications that students must meet, either with or without accommodation. In the disability services world, in professional schools especially, over the past several years, there has been kind of a significant push toward more inclusive language in technical standards. So the two types of language that are talked about is organic versus functional language. Organic language is kind of the original language that technical standards were written in. I would say it's, kind of old school language. It emphasizes how a student goes about completing a task. So an example would be candidates should be able to hear heart, lung, and bowel sounds, for example. Whereas the functional language would be focusing on what is the task that's required, with or without accommodations or assistive technologies. So that would be written, candidates should be able to detect heart, lung, and bowel sounds. So you can see the difference there. If you were a prospective student who was hard of hearing and you read the word hear, in the technical standards, you know, that might seem a little prohibitive, a little discouraging, you know, definitely not as inclusive and welcoming as detect. When they see the word detect, you know, that signals to them, hey, I could use a special amplified stethoscope to meet that technical standard. This university is welcoming. Okay, so how is ATSU doing with our technical standards? We're doing pretty well. Our technical standards are publicized in the university catalog on the website, so prospective students can find those. It is clearly stated in all the technical standards that disability-related accommodations may be requested, and students are directed to our office. We actually talk to, you know, a fair amount of prospective students each year about disability accommodations. So that's great. We're doing well. Room for improvement. Hey, there's always room for improvement. You know, we could be replacing some of our organic language with functional. So if any of you are on your technical standards committee, you can kind of keep that in your back pocket. Seems like there have been some questions come in.
You just addressed one of them, and then
Okay.
we had another comment. Organic versus functional feels a bit like learning outcomes versus competencies.
Well, competencies, the technical standards are based on expected competencies, but you still can change the language to be functional rather than organic. Hopefully that makes sense. Okay, Marty is going to talk more about accommodations specifically.
Thank you. So academic adjustments or accommodations are going to be terms that we would use interchangeably. And it's basically whatever we're approving that we would adjust in the academic environment for accessibility. You know, as a post-secondary institution, we're required to provide academic adjustments that are necessary to ensure that we're not discriminating on that basis of disability. So some examples of the adjustments that would be appropriate, they're going to be on an individual based on the needs of that particular student. However, their disability is affecting them, we want to make sure that those adjustments are appropriate. So they can include auxiliary aids and services, modifications, requirements as necessary to ensure equal educational opportunity. There are adjustments both in the didactic and the clinical environment. Some of the things that we may do for the didactic environment would be providing a note taker, authorization that the student can record a lecture so that they would have a chance to listen to that audio later, a sign language interpreter, extended time for testing, captioning if there's videos that are used in the classroom, or maybe some adaptive software or hardware that would help with accessibility. In the clinical environment, a lot of things are going to be more on that specific needs and based on the learning outcomes. In the clinical environment, there's going to be adjustments appropriate, such as maybe a reduced work schedule or adjusted time to log patient encounters. Really, it's part of our role to work with those sites to ensure that the adjustments are appropriate. You know, for example, if we have those adjusted work hours that are approved, that we're not changing the requirement that a certain number of clinical hours are necessary to graduate the program or to meet requirements of an outside entity. It's something where it's just going to look a little bit different, that adjusted work schedule might mean fewer hours in the day, so they're going to spend more weeks in that environment. So those are some of the things that we'd want to look at and determine, is a particular site a good match for the student based on their caseload? Would that be an appropriate thing where that type of adjustment would be appropriate? I'm going to take you kind of in the Oz, pull back the curtain, what's going on in that private environment where we're actually determining eligibility and the specific accommodations. This is something where what the student provides, it is kept confidential, and we've got to evaluate things on certain criteria. So just because they have disclosed a disability doesn't mean that that's automatically going to translate into certain accommodations. We're going to look at, does this impairment actually rise to the level of a disability? You can have 5 students that all have the same diagnosis, let's say ADHD, and the way that it affects each of them individually, they may not all be meeting that legal definition for Section 504 that we're looking at, where it's considered a disability that we would require an accommodation. We want to see, is there a relationship between what the student's requesting from us and what the disabling condition is? So we've got to determine that match. And then some of the requests may not be reasonable. We're not required to lower or substantially modify educational requirements. Even though we're required to extend testing time, that doesn't mean we would have to provide a whole separate test where different things are being measured or certain things are not being measured. So in that reasonable category, we would say, does it fundamentally alter something that's required? Is it lowering the expectations? Especially with the clinical environment, does it result in a health or safety threat to others? So we've got to take that into consideration. And then the last one listed here is a financial burden, an administrative or financial burden. Historically, this is not a good argument for most universities. They're not going to look at your department's budget or our department's budget. They're going to look at how much money does this university have, given all of the research and athletics and what other income contributes to their revenue. So that's a much bigger pot of money. So it's not a very strong argument. We would only consider things outside of our university if it was like a national testing exam that's a requirement of graduation. Other than that, we're looking at specifically what's required to graduate from our programs and the criteria that we would have as a university, as opposed to something like, would the student be employable? We really can't consider things in the future. We've got to look at specifically our program and how would they be successful in completing the ATSU program. And next, I'll transition over to Jennifer about how faculty can help out.
Okay, great. Thanks, Marty. Okay, so how can you as faculty help? Well, we hope that you are going to be open to student differences, and we would ask you to normalize use of resources. Encourage students to visit with learning and disability resources. Remember that learning resources is for all students, and disability resources obviously for students with disabilities. We try to do a really good job of letting students know early, before they even matriculate and during orientation, that disability resources is the place to go if you are requesting accommodations. But we all know that sometimes students miss our messages. So if you ever experience, if a student ever comes to you and talks about a disability or says, hey, I had extra time in undergrad, I'm looking to get extra time here, or they try to give you their disability documentation, please refer that student to our office. Also, if you are a faculty member who is also a clinician, and as you get to know your students and you kind of hear some things that make you wonder, oh, I think this student might have an impairment or a condition that might be considered a disability, I know you're meaning to be helpful, but I would caution you against bringing up a disability. It is the student's right and responsibility to self-disclose disability. And if you suggest a disability where there isn't one, that can put us on the hook for providing an accommodation when there might not be one required. And that's because the ADA's definition of a person with a disability also includes individuals who don't have a disability, but who are regarded as having a disability. So I would just say, if you're wondering, refer them to a learning advisor. All of our learning advisors are trained, and on our intake form, we ask about potential impairments that might be a barrier to access in learning. So refer. We would love to see all those students. Don't provide accommodations to students without receiving their official notice. When we approve accommodations, we will issue an official notice of approved accommodations to that student. And if you receive one of those, that is the green light that the student now requires and is going to use accommodations. If you do get one of those and you wonder, I have no idea how I'm going to implement this, please contact us. We would love to help you figure out how to do that. We do that. That's what we want. So just be aware and open to those differences, and normalize use of resources. I would say those are the two biggies. Students, you know, they're all very independent, and asking for help, even coming into our office or contacting us, can be hard. So I would normalize that for them. I see maybe a question. Oh, Marty, did you answer it?
I think I answered that one. Yep.
Okay, thank you. All right. Okay, so next, I think we are to our student sample student scenarios.
Yeah, thank you. So we've got 3 different cases that we thought we would get some interaction on to see what would be the thoughts on these particular student scenarios. So we'll use Abdul as our first one. Abdul has been diagnosed with an auditory impairment. So this impairment, it's going to make it difficult for Abdul to hear an instructor in a room where there are other students as well as some background noise. But this particular course is only taught as in-person group instruction. We do also have a history of medical documentation. I know one of the questions in the chat was, how do we determine things with that? So we'd want to make sure that documentation is going to meet certain criteria. So basically we've met that through the medical documentation. It's got a history of hearing impairment, and even includes adjustments that have been made by previous academic institutions, which is helpful to us to kind of see what's worked in the past, even though it's not required. So with this case, we've got adjustments that are approved because basically they've substantiated that there is a need for equal access based on the impact of this physical disability. So for Abdul, we've determined that there are adjustments that are appropriate. Would there be any adjustments that may help this student in your classroom? Is there anything that you think could help out?
Audio recording of lecture with background noise cleaned out, sitting in front of the class.
Excellent examples.
Assistive listening device, great. Transcript of lecture prior to class. Captions on recorded lecture.
You guys are all over that. These are great examples of things that could be done. It's not something too strenuous to just provide something to grant some equal access. I know one of the things that I remember with this type of scenario, and we talked about things with the position in the classroom, even just if the room allowed for a semicircle layout, where the students are seated in a manner that they can actually see each other speaking, that can help if there's a lot of class participation, that they're not missing out on that because they're only facing the instructor. So a lot of adjustments, and it sounds like you guys have great experience with this. So yeah, these are all excellent examples. Should we go on to our second case?
Sure. Okay, case number 2 is Berta. Berta takes medication prescribed for ADHD symptoms. Berta will often fidget during class and has trouble sitting for long periods of time. 2 years ago, Berta's family doctor administered a 10-question self-report survey. Based on those responses, Berta has been taking medication for ADHD ever since. Berta has submitted a request for accommodation to Learning and Disability Resources. The application includes a 2-sentence letter from Berta's family doctor indicating a diagnosis of ADHD. Okay, so 2 questions. Does Berta have a disability that requires accommodation? And if so, are there adjustments, or if not, are there still any adjustments that may help the student in your classroom? What do you think? She needs further tests to determine. Yep, you nailed it there. That's the answer to the first question. We don't know. We don't know if Berta's impairment is actually substantially limiting. We would need additional information. There are assessments out there. They're called continuous performance tests that provide an objective measure of a person's attention. We like to see those to help us make that determination on how substantial is this impairment. Let's see, what are some of those? I saw some ideas come in about potential, let's see, let's scale through here. Capture, okay, wait, I'm on the last one. Further to, okay. Allow Berta to stand or walk around, right? That's a great idea. Yeah, like maybe preferential seating at the back of the class where the student can stand up and walk. That won't be distracting. Her behavior pattern would seem to impair her learning. Not a disability. Yep, well, we just don't have enough information to know that for sure. How would you advise Berta go about getting the official determination if she feels she needs? Again, there are specific tests that can measure attention that we would ask her to get. We have had some students in the past with economic issues that limit their capacity to pay for the necessary evaluations. Yes, that's true. It can be difficult, and oftentimes insurance does not cover that. That is true. And another idea is ensure recordings of classroom presentations are available. Yep, that's a great one. Access to the recorded lectures so that if attention wanes in the middle, student can listen to it later. Maybe here's kind of another idea, and this would be more to the instructional design side of things, and we're definitely not experts in that. So, but just an idea, you know, if you can put some learning activities maybe in the middle of your lectures, if you can. You know, we tend to pay better attention to novelty, so kind of breaking things up can help all of us really stay more focused. Also, just realize that some students with attention issues kind of need to fidget to focus. So if a student is using a fidget device, like maybe a stress ball, that could be helping them focus. So, you know, hopefully they're not distracting others with it, but that might be the case, what they're doing with that object. Did I miss any questions? Does anybody know?
Nope, you're all caught up.
Okay, great. Okay, we'll move on to our last case. Oh wait, there's one more question. If Berta wasn't able to afford the additional evaluations, LADR would not be able to perform formal accommodations, correct? Does that mean faculty cannot do any of these suggestions to accommodate her? If you know that a student is having difficulty, you can allow some of these things without receiving official approval. But typically when, you know, we're kind of talking about test accommodations, I would say, you definitely don't want to provide additional time on a test or make a significant change to the learning activity without approval notice. But it's true. We might be able to provide provisional accommodations so that the student could have some extra time to gather that information. We do that. Sometimes students have older documentation or document, if we have a significant amount of evidence from their undergrad years that they had these accommodations in the past, but we're kind of wondering about current impairment. Sometimes we get a lot of documentation that's in the K through 12 environment. And so testing was done maybe when they were children. And things change or can change sometimes with things as we age. And so, we're typically looking for assessments in the adult age range, or at least close to that. So if a student has a significant amount of a documentation, but it's older, we might provide provisional approval to give that student time to get that additional testing.
Well, I'll go on. Our third and final scenario would be Charlie. Charlie has a long history of medical issues. The experience of going through multiple surgeries and rehabilitation has inspired Charlie to seek a healthcare career. So we've got someone who's very motivated to be here. Charlie is prone to seizures and frequently experiences involuntary tremors. These are affecting the legs, arms, and hands. There is a valid recent neuropsychological test showing difficulty with retention of new information. With the neuropsychological test, just as a side, that is something that would meet our criteria for one of the assessments that we're looking for. So Charlie has a history of receiving test adjustments, and that's at a rate of double the standard time. So an hour-long test, the student has in the past been approved to have 2 hours to complete that assessment. So that's the history that we have on Charlie. Let's kind of go on for that case study. We've got Charlie has submitted a request to Learning and Disability Resources. And the request is that they want to be exempt from any hands-on procedures. Their program of choice is the DO program. So they're looking to start the DO program next fall. So how do you think that Learning and Disability Resources at ATSU University would respond to this type of request? And I know we've got a lot of things going on here. I see no exemption. Yeah, that's a very, very possible, very strong possibility on this. We'd be looking at kind of each of the requests. For example, the double time, although it may seem like a lot, it can be appropriate if we've got documentation that can back that up. So if they were looking for double time on the assessment, that may be reasonable. But some of the other requests, if we've got an issue where the technical standards are not going to be met, that's going to be a separate issue where you must meet the technical standards either with or without accommodations. And if the accommodations aren't something that would have them meet those requirements, then they may not otherwise be eligible or qualified to be in the program. So one scenario on this is the student may never make it to our classroom if they're not able to qualify for the program. So this one can be kind of tricky. We probably would need a lot more detailed information about what's going on. We'd have to have some specific questions, particularly if we've got, they're using their hands as part of the requirements to graduate from that program, and they've disclosed or we're aware of something where their hand may go through tremors. How frequent is that? How severe is that? There would be a lot of questions that we would want to know about those specific limitations to determine, does the student qualify for this particular DO program? So yeah, this is one that the student may or may not continue on with our program.
And in the chat, people are kind of getting that. No exemption. Would Charlie's hand tremors exclude him based on the technical standard motor requirements that include a requirement for motor precision? Yes, maybe. More time, yes, but I would assume hands-on is part of our technical standards. Right, so yeah. Okay, so we are gonna wrap it up with a short video of Dr. Chris McCullough, and he will be talking about his experiences as a student with a disability?
About 5.5, almost 6 years ago at this point, I was injured in a slip and fall accident at home. I slipped and went backwards and my neck landed on the edge of a very thick, hard glass coffee table. And it popped one of the vertebrae in my neck clean out of my spine. I talked to the doctors who were in my rehab and he told me, absolutely, you still can still be a doctor. And I thought, okay, well, I can be a doctor, I can't be a surgeon. That's what I always wanted to do. Until I talked to a friend's wife who was a surgery resident who said, yeah, you can still, why not? You'll find a way to make it happen. Well, the first thing I tell any of the people who are interested in pursuing medicine or some other, significant task after having a disability is don't listen to the people who tell you you can't do it. I remember the first time I went into an operating room as a medical student. I was very, I don't want to say apprehensive, but it was a nervous time because it was the first moment I'd be standing at the operating room table using the adaptive wheelchair. And it was just unbelievable. The first case, I didn't really do a whole lot, but I remember just the excitement at standing at the table with everybody else, doing what I'd wanted to do ever since I was a kid. I think the big advantage to being, having a disability that's, especially one that's visible, is that I can use it to connect with patients. They see it and they'll know that I've been in the bed before, I've been through procedures, I can tell them I know what it's like to go through this. One of the things that's important to me is that other people have the same experience I did. If they've been through it and, some traumatic injury like this, if I can show them, hey, I'm doing it too, then so can you.
Okay, so questions, comments? I actually had the pleasure of hearing Dr. Chris McCullough speak in person at a disability conference. So he's a pretty amazing individual.
Jennifer, I had a quick question. So we heard the doctor talk about how he was nervous when he first approached his surgery. I think back to our students who are coming into our programs who have accommodations. That nervousness, I'm sure, is there. They're excited about being here. You've said we can't out and out address it. We don't want to call them out. How can we make them feel more a part of the community without singling them out? You shared some really good ways that faculty can help them individually, but how can we do that in a community atmosphere?
Well, I think if you're ever addressing disability issues in your classrooms, use inclusive language. I guess, that is kind of a hard thing to do, to encourage that without specifically calling it out. But, we really just can't. So just be open, to differences. And I guess when students, when you get the sense that a student is struggling, reach out to them and, just make contact and say, hey, what's going on? And, do you know about these resources that are available to you? And that's what I would say.
Great, thank you.
Okay, well, this is our contact information for everyone's reference. And you can email us, call us, just email disabilityresources@atsu.edu. Okay. I guess I will advance to this last slide then.
Great job. Thank you, Marty and Jennifer, for a wonderful presentation. I hope that you will all join us on April 14th for part 3 and the final session in our Building Community series, where Dr. Barbara Maxwell will guide us over the hour in providing teaching strategies designed to help us create an inclusive community in our classes. You'll see it advertised up on your screen right now. If you have any other questions for Jennifer or Marty, we'll stick around, but thank you all so much for joining us over this last hour. We appreciate all of you.